Welcome. Today, I want to spend some time on talking about how important it is to keep our health, both physically, mentally, emotionally. So, there are 5 components to this, and these components are lifestyle, and wellness is well being, uh, keeping down inflammation, and tapping into the plasticity of our brain. There are 5 components to well-being, especially mental health. And these components are optimism, resilience, grit, and humor. I'm going to be following a PowerPoint that I have made from my integrative medicine training in mental health. And one of the important things for overall health is social connection. There's conventional treatment, exercise, nutrition, sleep, spirituality, mind-body connection, and dietary supplements. The thing is that if there's positive change in one area, it can create a synergistic effect in the other areas. Physical activity and nature really improve all areas. So to talk about inflammation, the causes are stress, anxiety, and depression. Inflammatory cytokines create a neural circuit of inflammation affecting your motor movements, your motivation, your mood, your arousal, and your alarm. And growth factors, as they are involved in synaptic plasticity, are interacting with your neurotransmitters in your brain. And you need serotonin and dopamine. Now, reversing this is neuroplasticity in revolutionizing the whole mental health field. Positive intervention and mind-body approaches have been shown to be dramatically helpful. Exercise, especially green exercise, meaning outside, outdoors. Even having an artificial plant is a reference to nature is going to be helpful. Having good, again, green nutrition and really dark green, things like chard and kale, broccoli, spinach, all those dark green things. The other thing is positive social relationships. They actually change the structure and function of the brain at any age, at any time. It is quite amazing and wonderful how we can use that. So prevention of negative things going on in our lives is physical activity. It's a triad. Goes depression, then sedentary behavior, and then cardiovascular disease. That's the triad. So the prescription is 150 minutes a week, both for children and adolescents. It's 60 minutes daily. For 18 to 64, it's 150 minutes of aerobic activity at least twice a week, and building as long as it can be fit. The endocannabinoids and brain-derived neurotrophic factors, or BDNF, is neuroprotection. It helps your brain to stay healthy. Nutrition. So when we go to nutrition, whole foods, as in the Mediterranean diet, scarcity of micronutrients such as magnesium, folate, vitamin B12, D, and omega-3 fatty acids are tremendously damaging. Your gut biome connection to the brain uh, with the brain-derived neurotropic factors and irritable bowel disease are very damaging to the brain and overall body. So fermented milk with probiotics or um, pickled things are very helpful to help you get good biotics. So the neurologists that I deal with, one of the top in the world, I will quote, is Dr. Maria Ospina. Dr. Ospina specializes in movement disorders, and she recommended prebiotics rather than probiotics. And prebiotics are your green vegetables, your dark green vegetables, and of course your dark blue and red blueberries and strawberries and grapes are the other end of that. So one of the important things also to be preventative is sleep. The benefits of sleep affects physical and cognitive function. It affects brain plasticity, the ability to heal the brain. It affects memory and emotional processing. It helps your cardiovascular system, your respiratory system, your cellular and immune function. Clearing the brain waste at a higher rate and sleep than when you are awake via your cerebrospinal fluid. So there are different postures that are more helpful for sleep. Sleeping on your left side seems to help clear out the proteins of the brain more. Now, the risk of sleeplessness is a vicious cycle of sleeplessness compounded by worry about the inability to fall asleep. Especially older adults have a problem with sleep maintenance via early awakening and depression, having sleep apnea, having medical disorders like cardiovascular system disorder, cancer, metabolic and autoimmune disorders, infections, and obesity. Those are huge. Your DNA methylation and epigenetics are also affected. There is a scale, it's called the Epworth Sleepiness Scale. You can check that out, and it can help you to find a method to have better sleep. So positive psychology and post-traumatic growth are a big issue, because when we get a diagnosis of a bad condition that we have to deal with, like some of my clients that have that have Parkinson's and heart disease or various cancers, things like that. When we deal with that, we get an automatic traumatic jolt to our body. So optimism has been shown to lead to overall improved quality of life, better health, fewer limitations, less pain, more energy, fewer work-related problems, higher performance of social activities with less interference from physical or emotional problems, and more frequent feelings of calm, peace, and happiness. So optimism, how do we deal with optimism? Optimism is a learned behavior. We don't have to be born with an optimistic attitude. We can learn how to be optimistic, and that's to question our negative thoughts and feelings and challenges. I'm still constantly learning to look at things in a more optimistic way than I used to. And that stuff sneaks up on us, and we're not even aware of how sneaky it is. And so many times I find that it's my petty little ego that gets in there. And I used to think I didn't have an ego, and I found out it was much bigger than I realized, and it was very sneaky. Mayo Clinic had a cohort of 7,200 people with pessimistic attitude and anxiety and depressive elderly who had a higher rate of mortality. Optimism had a strong protective influence against depression, anxiety, alcohol, and drug use in both in teens and in the elderly. Optimism can be acquired learning. So, to develop additional assurance, resilience. Resilience is related to optimism, and it can be learned also and strengthened with positive mantras. Mantra is a phrase that you repeat to yourself over a period of time. I used to bite my nails, and I don't do that anymore. And I overcame it with a mantra. It was a spiritual mantra for me. My higher power can do for me what I can't do for myself. I would put my hands on the steering wheel and just say that over every time I tried to put my hands in my mouth. And grit. Grit is a mental toughness and courage. It's a firmness of mind or spirit, and it is unyielding courage in the face of hardship or danger. From the Middle English, grit or sand. The other thing to develop for additional assurance is humor. Tasteful humor can increase coping skills and capacity and patience and caregiving via mindful laughter, even in the depth of difficulty. Laughter yoga is one that can be very helpful. Uh, there are a few sessions that I've done laughter yoga. So, well being and neuroplasticity are so important in our life. So, there are 6 components for authentic happiness. This is at the University of Pennsylvania, Dr. M. Seligman. You can go on their website and you can find it. So these 6 components are self-acceptance, a purpose in life, environmental mastery, in other words, being able to have some power over your environment, positive relationships, personal growth, and we don't ever have to stop growing if we don't want to, and having autonomy, having a choice over what you are able to do or think. Well-being and physical health and inflammation are very difficult to deal with. So, cultivating happiness, doing well-being therapy, mindfulness, and loving kindness meditation, it helps to increase the telomeres. These are the little caps on the end of our uh, cells, our DNA. So, dealing with anxiety, which does comes up for all of us. It's one of those things that sneak up. So there are 5 major diagnostic groups for anxiety, generalized anxiety disorder, panic disorder or phobias, social anxiety disorder, obsessive compulsive disorder, and post traumatic stress disorder. So, so the major symptoms have to be occurring more days than not over a 6-month period to be able to be diagnosed. So if you have it for a day or a few minutes, even a whole week, it does not make you uh, diagnostically uh, ill. So restless, fatigue, concentrating, concentration is difficult. You become irritable. You have muscle tension, and you have sleep disturbances. These are the symptoms for generalized anxiety disorder. For panic disorder, you have autonomic arousal, maybe dizziness, perspiration, hyperventilation, in other words, breathing fast or not feeling like you can breathe, and heart palpitations. Social anxiety disorder symptoms are fear, anxiety when exposed to scrutiny by others, and feeling judged. Those are terrible feelings. Obsessive compulsive disorder symptoms are intrusive and irrational thoughts and ritualized behavior, having to do something a certain way or it doesn't feel right and you can't function with it. Post-traumatic stress is exposure to actual or threatened death, serious injury, sexual violence, or separation for children 6 and under from their parents. So some of the treatments for that, for anxiety, the conventional are uh, pharmacological, and it needs an appropriately trained clinician. They use psychotropic prescription medication, and these are side effects on social functioning and other medical risks, and there are safety concerns. The other option is psychotherapy, and that also needs an appropriately trained clinician. Counseling, talk, or therapy, that would be a psychologist or a counselor. Support groups are tremendous. Cognitive behavioral therapy also would be a clinician, or mindfulness-based cognitive therapy. These are other options that are conventional. Now, the integrative approach is intervention can be added to the conventional. It does not is not contraindicated. It does not interfere with it. So mind-body therapies are tremendous. Breath work is very important. More and more it's showing clinically and evidence-based for it. Dietary supplements, yoga, exercise, whole system like traditional Chinese medicine, acupuncture are wonderful. Ayurveda are good. Tai Chi, massage, music therapy, energy medicine, Reiki, healing touch, aromatherapy are all options that can be helpful to someone. And that's very individual. You keep an open mind. You may be surprised at what can work for you. Effective aspects lie in the patient's control, meaning that you have a choice over what you choose to do. Supplements like kava kava with glutathione for liver protection, uh, inositol, part of vitamin B complex, and nerve transmission are very positive and beneficial. Chamomile tea, bacopa extract, lemon balm, L-theanine, passion flower extract, rhodiola, and valerian are some of the over-counter things that may be able to be used. Uh, Always consult with someone that is experienced in those areas. Uh, don't try to just guess. So, a plan, you want to make a plan to get your recovery. So, start with a thorough health and psychic evaluation. Do some screening for medical, pharmaceutical, and dietary supplement interactions. And you can talk to your pharmacist about that. Lifestyle approaches with the likes and interests of your own input. Mind-body approaches, dietary supplements, and conventional modalities with your appropriate professionals are ways that you can follow through and have your own plan and course of action. Now, depression, some of the symptoms and triggers for depression, untreated, it can be very serious and very life-limiting. Depression is a dulling of the senses and emotions like pleasure, joy, appetite, creativity, and positive social actions. The seasons can trigger depression. Situations like a death of someone you love, or divorce, losses, bullying, or other changes. Even positive changes can have some depressive effects because the changes are a lot, there are losses involved. The World Health Organization's leading states that the leading cause of disability is depression. It's the fourth illness in the world. In 2012, there were 850,000 suicides. Well, right now it's even worse because we're having the drug epidemic. So some of the risk factors are inflammation in the body from anxiety and depression, obesity, cardiovascular disease, metabolic syndrome, anxiety, sleep disturbances, irritability, and substance abuse. Any of those things can lead to depression. So the conventional way of dealing with it is screening questions like, do you have little interest or pleasure in doing things? Yes or no. Are you feeling down, depressed, or hopeless? Yes or no. Your family or personal functioning, extensive labs for deficiencies, medical condition screens like lead toxicity or hypothyroidism or zinc deficiency. Those are conventional ways that you can get blood tests and get other tests that can be contributing that. So psychopharmacology uses antidepressants, serotonin reuptake inhibitors, and psychotherapy. These are the conventional ways to deal with depression. So the mind-body or integrative way to deal with it is to get biofeedback, get autogenetics, use neurofeedback, clinical hypnosis, guided imagery, very important and very valuable, progressive muscle relaxation, music therapy, yoga, tai chi, qigong, patient support groups, cognitive behavioral therapy, prayer. or spiritual mantras, and manual medicine like massage and cranial sacral massage, art, music, and dance. All of these are things that can help to relieve depression and anxiety and emotional issues. So, in conclusion, verify with a provider who is trained in the modality of your choice. Think about all these options that you have to make your life better. There are solutions available. Don't suffer alone. Use the handouts. I have handouts that you can ask for. You leave me a note in the note below. I will read it. I can send you some handouts in regards to the things that you're interested in. So the combined effect of exercise and foods and preventing neurological and cognitive disorders are on the National Institute of Health. They have articles. Uh, I work at Desert Palm Physical Therapy. We have tremendous therapists that are helpful, and integrative medicine. The integrative medicine section of the University of Arizona, they have things online also that can be found. I'm still learning how to do this, so I don't know how to put all the links in yet, but I will help to get the things that you need if you will contact me. Have a wonderful afternoon and keep optimistic.